finest performances are recorded.
Hello, good afternoon. I'm so glad you're here. This is the information session about the open request for proposals with Best Starts for Kids for the Family and Community Developmental Screening programs. So this session today is going to be recorded, and we'll be providing a PDF of the slides that we're presenting today. Dropped one in the chat already, but we'll do it periodically as more people come in. Let's see, and today what we intend to cover will be just a little bit of background of Best Starts for Kids that leads us up to the work we're talking about today. We're going to review key elements of this request for proposals. We're going to review the criteria. You'll get a demonstration on how, as an applicant, to apply in our Zoom grants database, and we'll have time for questions and answers along the way. As you have questions or thoughts or things you want to raise up, please do add them into the chat box. I've got colleagues here who are helping monitor the chat, and we'll make sure that questions get addressed. And same if you want to speak them out or talk about it, we will have time at the end where you can unmute to do so. Want to tell you about who we are. And so I'm in the middle there. I'm the program manager for Universal Developmental Screening and Best Starts for Kids. My name is Juliet Escobar. I use she, her pronouns, and I'm really excited about this work. And I'd like to invite my other staff members here today to say hello.
Hi, everyone. I'm Alice Casey. I use she, her pronouns, and I'm an operations and contracts coordinator with the Developmental Disabilities and Early Childhood Supports Division. And I'm supporting this RFP in the back end of working with you on Zoom grants. Any questions that you can ask about how to apply, or if you're needing support in any of the application process, please do reach out.
And hello, everyone. My name is Linda Carr, and I'm an early childhood transitions lead on the Developmental Disabilities and Early Childhood Support team. And I work closely with Juliet in Universal Developmental Screening, and also work closely with our Early Support for Infants and Toddlers team. And I'll be working on this RFP and helping to manage some of the programs that are funded. We want to give you some background on the Best Starts for Kids initiative. The vision of Best Starts for Kids is that kids are happy, healthy, safe, and thriving. We want to see babies born healthy, kids thrive, and young people grow up to be happy, healthy, successful adults. Best Starts for Kids' mission is to strengthen families and communities so that babies are born healthy, children thrive, and establish a strong foundation for life, and young people grow into happy, healthy adults. There is a Children and Youth Advisory Board that was appointed and approved by King County Council that advises funding decisions with Best Starts for Kids. They have created an equity statement that's important for us to hold in mind. Equity is an ardent journey toward well-being as defined by the affected. Equity is disruptive and uncomfortable and not voluntary. And equity is fundamental to the community we want to build. The principles of the Best Starts for Kids initiative are promotion, prevention, early intervention, and policy and systems change. And this RFP falls under funding for Best Starts 2.0. This is funded through a 6-year property tax levy. That's about 19 cents per $1,000 of assessed property value. And the average cost to a home in King County, around $600,000 home, is $114 per year. And those funds are pooled to create all the funding for Best Starts for Kids activities. These are the investment allotment amounts for the 2.0 levy, which started last year and runs through 2027. And you can see that childcare takes up a big chunk right off the top. There are capital projects being funded up to $50 million. Approximately $10 million is going into technical assistance and capacity building so that community-based organizations can apply for these funds and build capacity to deliver services. Homelessness prevention is another big chunk of the money. Investing early, which is where this opportunity lies. This RFP is in the P to 5, prenatal to 5 segment. And then under that, there are sustaining the gain efforts geared at children and youth age 5 to 24. And then Communities Matter is getting a portion of the funds. And then a portion of all Best Starts for Kids funds are used for data collection and evaluation to ensure that we're doing the very best we can with these dollars. And we'll have the next slide. I'll turn it back over to Juliet to talk more about the background in universal developmental screenings.
Thanks, Linda. So starting in 2017, this strategy of the prenatal to 5 section of Best Starts, we started with a research project. We stopped and asked and wanted to know how people felt about developmental screening, where it was working, where it could be working better. And so we launched a large project called the Landscape Analysis along with Cardia Services. And again, we really wanted to hear some of the nuances that how people were experiencing screenings, where it was happening, where it wasn't, what was going well, and where we could focus our efforts. Around the country, universal developmental screening efforts are mainly focused on pediatricians, medical clinics, but as Best Starts was just getting off the ground and we are investing in many new programs for young children, we really wanted to hear from early learning providers who may also do developmental screening and home visiting and childcare, playgroups, schools, libraries, doulas, and even more. We also really wanted to hear directly from as many families as we could. And so that took about 2 years and culminated in a strategic plan that really guides all of the work that has been done around developmental screening and Best Starts, and plays a big role in the request for proposals I'm going to tell you about today. So this research project was guided by a community group of experts who led all the research efforts and brought sort of the findings back to community and then helped group everything into themes, which were these 4 goals. So the 4 goals are to ensure coordination of early care, education, healthcare systems so they can respond quickly to families' needs. Number 2 is to strengthen child services workforce through training and transforming organizations and systems. Number 3 is to make developmental screening and services that celebrate developmental progress available and accessible to all families. And 4 is to drive equity by enhancing screening tools, practices, referrals, and services that meet families where they are. And each of those 4 goals has many sort of sub-goals or strategies embedded in each that were to really speak to how to achieve these goals. And so that was all completed in about 2018, and again, guided the work that we did. But then, as preparing for this opportunity, really recognized that a lot has changed in the world since 2018, and wanted to take another look at those 4 goals. And so starting in November and working through January, I brought together an advisory group that met and learned about the strategic plan and all the research that went into it, and sort of did a reprioritization. And through some processes, they decided that all 4 of the goals were still very relevant to the world today and the field of early learning, but certain elements and strategies of each of the 4 goals either had not really been fully worked on or needed a new approach. And so with their guidance, really along with the implementation plan for the second iteration of this Best Starts for Kids levy, really sort of informed how the new funding opportunity is laid out, which I will tell you shortly. What I want to lift up now is how the words that are used in pieces of the implementation plan to describe developmental screening work. So for example, it says early childhood practitioners use developmental screening to celebrate milestones and monitor signs that young children may be delayed in one or more areas of development. And that is a very different orientation than you're going to find about developmental screening most anywhere else, where it's a very deficit-based process to look for problems. Okay. The other place I'm calling out, it says families are supported in understanding their child's development and connecting with a wide range of resources to support growth and learning. So it's not just find out what your child can't do and get them a specialist to help them do it. It's really an exploratory process to better know a family and help them understand their kiddo better and find out what other things aside from development can be supported. Okay, so that's just all to sort of frame how we look at developmental screening here at Best Starts. So the request for proposal that's open right now, ideal applicants will reflect really a deep understanding of the language and culture of the parents and caregivers they serve. We recognize that child rearing is very culturally situated, and so we want to start with a strong foundation there. Ideal applicants will uphold and center community needs and interests and decisions in anything they do. They'll understand the local impacts of historical and current systemic racism, and know the landscape of resources and services available to families. Understand and know the range of barriers families face when seeking resources and services, and really understand any stigma that may be present in their community around developmental differences, as well as provide direct service staff equitable compensation. As with all of Best Start's other funding opportunities, this request is open to nonprofit organizations, for-profit organizations, community-based organizations, tribe and tribal organizations, and public or governmental agencies serving communities in King County. And small nonprofits and community-based organizations are encouraged to submit proposals. Partnerships are also accepted. Some of the funding priorities. So the purpose of this RFP is to fund developmental programs and learning opportunities in partnership with groups and organizations that demonstrate the following 4 attributes. Culturally rooted. So founded with the cultural norms, traditions, and values of a specific community. Family-centered. They hold families as the experts, and services reflect the needs, desires, and strengths of the family. Relationship-based. They have established or establishes and maintains safety, consistency, and trust in relationships and partnerships that are mutually accountable, transparent, and responsive. And finally, strength-based and inclusive. So they will dispel myths and promote positive messages about early childhood milestones, brain development, and differences in development to reduce stigma about delays, disabilities, and mental health concerns. I just want to call out that normally at this point, when funding opportunities are reviewed, you would normally see something about organizations that have worked with families for X number of years, or programs that have done developmental screening for 500 families. And I've intentionally focused on attributes here. All of the work that's going to be done in the scopes of work I will describe to you shortly, are going to be guided by these 4 funding attributes. So in summary, there is sort of the logistics. There's about $7 million available. The RFP is open now and closes April 20th, 2 p.m. Contracts will begin August 1st and run through June 30th, 2026. There is no maximum amount to be requested. And we anticipate awarding between 8 to 15 programs. So,
Juliet, if I may, there's a question in the chat requesting a little bit more detail about the attribute culturally rooted and what you mean by founded with cultural norms.
Yes, sure. Recognizing again that especially as we do work in early learning or things that deal with early childhood, that often brings into scope how babies are raised and taken care of, how children are raised, how development is addressed and health is addressed. And so when I'm talking about culturally rooted here, I'm really speaking specifically to culturally rooted in sort of how the community thinks about child development, parenting. We want it to be sort of and by those that are the focus. And so while, organizations or whole, agencies that are culturally rooted in a specific community, that is, definitely wonderful. These 4 attributes are really speaking specifically to the work and to the focuses of the work that I'll describe. And so it might become a little bit more clear as I tell you what the work is, to think about how those pieces of work can be culturally rooted and family-centered. And so I'm happy to come back and speak more about culturally rooted and the other attributes, but let's talk about the work first. So these are the 4 attributes again, and again, they're overarching across the 2 scopes of work. So scope of work 1 would be family-centered developmental programs. So these are sort of the direct service programs provided to and with children and families. And so they can partner with families to increase interest and access to developmental screening and referrals for young children. They can destigmatize developmental differences and support parents to become trusted messengers of these topics in their communities. Scope of work number 2 are community-designed UDS learning opportunities. Here we are looking for programs that have been delivering relational, culturally, and linguistically rooted or responsive programming to young children and their families. Selected partners will design and provide customized learning opportunities to the audiences of their choice on culturally situated topics related to early childhood development. Scope of work 1 will have 3 different focuses that I'll tell you more about in the next slide, but they are celebrating early childhood development, supports for 3 to 5-year-olds, and parent champions pilot. Scope of work 2 provides in the RFP, and we'll talk about here today, 3 sort of deep buckets of details. So there'll be recommended topics for these learning opportunities, types of learning opportunities, and the audiences. So let's dig into scope of work 1, family-centered developmental programs. And yeah, so the first one I think of is sort of the most broad. This could be something that is a program that provides developmental education, developmental monitoring, and or screenings, which are all sort of different levels of intensity. This program could provide referrals with warm connections for families who do need or want additional developmental services, and should also include strategies to reduce stigma and address misconceptions about delays and disabilities and mental health concerns. So as long as it has those ingredients, it can be sort of designed as desired. And I'll invite Linda to talk about the next one.
This bucket within the family-centered developmental programs is an invitation for programs to design something specifically to support 3 to 5-year-old children. This is an area, a time period in child development where the service delivery system is not as clear and is sometimes difficult for families to navigate. So we're looking for programs to design supports by partnering with local child find or early childhood special education programs, locating families and informing them about their rights within those systems, building awareness about supports and resources, and promoting advocacy skills, and also offering developmental screening for children who've not yet had it. Many of the families in this kind of bucket will already have some kind of concern identified, but if they have not had anything, we would want them to receive some developmental screening as well. Back to you, Juliet.
Thanks. And the third is called Parent Champion Pilot. And this could be its own standalone thing you apply for, or it could be an element that's embedded in any of the other pieces of this RFP. Or this Parent Champion Pilot could be an add-on to another direct service program that's already funded. And this is a new idea. So the idea here is that we are lifting up and paying parents to provide the developmental promotion, the messaging. They're becoming developmental influencers among their peers in their communities, okay? So funded applicants, the organizations, will select, train, and support parents to provide developmental education, monitoring, and or screening to peers in the environments best suited for their communities. Parents will have opportunities to advise, co-create, or lead program creation or implementation, and to participate in professional development alongside the applicant's program staff. We will, along the way, for funded partners, be providing some sort of administrative logistics support, like how do we contract with parents and pay them? We're going to help with some of that, as well as some of the, once that's in place, some of the generative and content information in supporting parents. And so we anticipate some sort of community of practice and some capacity building support around that. Now we'll dig into scope of work 2, community designed UDS learning opportunities. So again, selected partners are going to design and provide customized learning opportunities to the audiences of their choice on culturally situated topics related to early childhood development. So for topics, you can suggest your own. There's a question in the RFP for that, but also providing some foundational content or a mix of soft skills here that were really lifted up out of the strategic plan, out of the research, out of the UDS advisory group that helped sort of update things and a lot of the work that's been happening in UDS over the past 3 years. So learning opportunities could address basics of development as relevant for that audience and culture, social emotional development, connecting ways, to connect with families and discuss development, how external influences can affect development, including lead poisoning, novel approaches to developmental screening to meet the needs of BIPOC families, and shared decision-making. So please remember that all of these topics and any that are suggested by applicants should be followed by, as relevant for the audience and their specific community, okay? And then we provide here types of learning opportunities. These are not, the only ones available. This is sort of to paint a picture of what we're looking for is not a large group workshop. It's not a classroom-based learning opportunity. It could be more of a discussion group or a peer group. It could be coaching, mentoring over coffee. It could be casual or more formalized, but accessible is what we're talking about here. And it should be what is of interest and makes the most sense and is going to have the reach and the impact for the specific audience. So who might the audiences be? They could be parents, expecting parents, they could be kinship caregivers, they could be the early learning practitioners working with children and families. They could be medical providers who are working with children and families. They could be the interpreters that support all of this programming. They could be just about anybody in this relevant in this world we're discussing here. And once this is all contracted and ready to go, funded partners will have access to some collaborative capacity building supports where we may do sort of a needs assessment, we may do some skill building among the groups who are doing this work, we may do some peer stuff, some sharing, some sort of community of practice that will be designed in collaboration with the people doing this work. I'd like to pause and see if there are any specific questions just about the scopes of work or focuses that are shown on this visual, and I will drop these slides into the chat. And then I will, I have more to share, but just want to see how this is resonating. Well, it's not your last chance for questions, so we're going to go forward. And Linda.
Okay. So if your organization is new to applying for an RFP, or if you're not, it's important to pay attention to the timeline. The RFQ was released last week on the 13th. We're having our info session today. We're going to have another information session, essentially repeating the same content, but it will be in person as well as online on April 5th. There is a deadline to ask questions. Questions are asked formally within the Zoom grant system. And that way we can make sure that the answers to the questions are consistent and that they're published for all potential applicants. The application due date is April 20th at 2 p.m. And after that, we'll go into a period of rating and reviewing the applicants. If needed, we'll do interviews with applicants at the end of May. And then we'll be notifying each of the applicants of whether they were granted or not in mid-June. And then we'll have a period of negotiating contracts mid-June through July. All of those will be signed, stamped, sealed, and in place so that programs can start on August 1st of this year. So the most important one to pay attention to here is that application due date of April 20th at 2 p.m. As is typical with most grants, and certainly within Best Starts for Kids, everyone who is awarded will participate in some performance measurement planning in collaboration with staff here at BSK. And this will include selecting performance measures from a menu of options that best reflect your work. We don't have one way of evaluating programs, and programs get to co-create what are the things they will be evaluated on with us. And then those who are awarded will be required to report aggregate or individual level data. And again, that's part of the contract negotiation, either quarterly or semi-annually. And that will include some demographic information. And then there's an annual narrative report that each grantee is expected to complete. And we have technical assistance available to help with creating what the data collection will be, what items will be evaluated, and how that gets reported to us. So some thoughts on the RFQ for rating and review. There's rating criteria listed in the RFP, and you'll want to review that really carefully and make sure that you address each question that's answered, because each question is scored. And the review panel really relies on the scoring rubric to make their decisions and ratings. All of the proposals will go through a formal review process with multiple evaluators reading and rating each applicant. And then there is an appeals process if once the decisions are made, an applicant is unhappy with the decision and wants to understand more about it or appeal that decision. And that's all outlined in the RFP. So in terms of tips for applying, we're asking for one single application, even if your organization is applying for multiple parts of this. So if your organization is looking to do something in direct service delivery with developmental screening and promotion, and maybe do a parent pilot as well, and also do some of the learning opportunities, it still comes in one application. You'll want to build into your application your planning, your hiring, and your onboarding. There is one unrated question that's important to know, that if Best Starts is unable to fund your project at the level requested, like unable to fund the whole piece of it, what areas of your proposal would you want to prioritize, or how would you adjust the proposal to deliver what's most important to you with a reduced funding amount? And then we encourage you to answer the questions very thoroughly. And then the questions are grouped by those 4 funding priorities that we mentioned earlier. Let's see. Oh, lost my way. Finally, the last part of this is a budget. You will be asked to submit a budget, and they should be developed for the entire term of the contract, so the full 35 months. And if you're applying as one organization, you would need to use the budget labeled lead applicants. So if people are collaborating with multiple organizations, there needs to be one lead applicant. And then individual organizations would detail their budget as well. And you could budget by an hourly rate or a full-time equivalent, depending on what the structure of your organization is. Be sure to read the instructions for sure on how to put together the budget. But the budgets aren't separately scored. They're not included in scoring at all for this RFP. And Juliet, correct me if I got any of that wrong. And then I think we're going to switch to a demo of Zoom grants.
Yep,
because
thanks for
all
that.
the applications will come this way.
Yes, so the RFP is accessible in this link on Zoom Grants. And so the application process and questions that you have to ask will all happen in Zoom Grants. So you'll see there are separate tabs. There's going to be a budget form in the budget tab that you will complete and then upload. And then once you've submitted your application well before the deadline of April 20th at 2 p.m., please do regularly check back on the Zoom Grant site for any updates, clarifications. If there's an amendment to this RFP, we'll do it. Otherwise, there may be weekly updated FAQs based on questions that are sent in so that we can provide full answers to everybody. If you do have a technical problem with Zoom Grants, as has happened in the past, submit a help ticket to Zoom Grants. There's an email. They are really responsive. And then allow sufficient time to ensure timely receipt of the application or to resolve any technical difficulties with Zoom Grants. Technical difficulties are not unheard of. So we encourage you to start sooner than later. And I'm inviting my colleague Tiffany to show us a Zoom Grants demonstration.
Great, thank you. All right. Hi, everyone. I am Tiffany No, and I use she, her pronouns. I'm a contract specialist with the Contracts and Procurement Unit in DCHS. So right now I am sharing the Zoom Grants page, and this is what you'll see using that Zoom Grants link that Juliet and Linda provided. So first off, to log in, you will log in using your email and password in the upper right-hand corner. And if you need a Zoom Grants account, you'll just click on this new Zoom Grants account button and then go through the steps to sign up. You are able to view the application without logging in, but to submit an application, you will need to log in. There are 2 rows of blue buttons that you see here. We have these ones at the top and then these tabs towards the bottom. And the buttons at the top, you can expand and collapse by just clicking on show or hide description or show hide library. This library here is where all of the RFP documents are available for you to download. So this is a really important section. And then scrolling down to where the tabs are, this is where you will fill out your application. So we have this summary tab with basic information about your organization, as well as the zip code question, which is asking what zip codes your services will be provided for. And this is to help inform King County Council about where our services are being provided. And then you'll just use the tabs to switch through the sections of Zoom Grants. So next up, you have the unrated questions. And these are all the questions that are not scored. And to get to the next tab, you can either click on the tab itself or the previous next buttons at the bottom. The next tab is rated questions, and this is where you will be putting in your narrative responses in the text box. You'll see that there's a 6,500 character limit, and it'll count down as you're typing in and as your limit is being used up. There is no save button for Zoom Grants, so instead you'll just click out of the text box and then a little icon will appear that says saving, and then it should go away. So just keep that in mind as you're working through. And like the others have mentioned before, make sure that your responses are thorough and clear. And then the final tab here is budget. And you can download the template to fill out, and then you'll just upload it over here by using the upload button, and then clicking out of that, and then it'll save your entire application. Zoom Grants has some quirks that you should be aware of. Like I mentioned before, there is no save button, but sometimes when you click out of a field and the save icon appears, it may stay longer than normal, in which case you can refresh your browser and then see if your response actually saved. If it didn't save, you will need to type your response again. So it's recommended that you keep your responses in a notepad or a Word document, just so you can have it there to copy and paste in case there are technical issues with Zoom Grants. Another note is that Zoom Grants does not accept formatting, and that includes bullets, special characters, things like that. That could prevent Zoom Grants from saving. So just keep that in mind as you're putting your responses into the text box. Again, if you have any questions, feel free to email Zoom Grants. I'll put their email address in the chat. And if you are experiencing issues right up to the 2 o'clock deadline on the 20th, right? Yeah, on the 20th, please email your application to the RFP lead to avoid a late submission. So if you are finding that your application isn't saving or you're unable to upload the budget, it's better to be safe than sorry. So make sure that you email that in so we can count it before the deadline occurs. And that's it for my Zoom Grants demo. I'll stop sharing. And if you have any questions, feel free to put it in the chat and I'm happy to respond to them.
Thank you, Tiffany.
welcome.
Next, I'm going to tell you all about technical assistance for applicants. So if you're feeling a little overwhelmed or concerned about the amount of requirements and logistics, rest assured, we have some help. And while I'm sharing my screen, I think we have some of our great technical assistance providers here today. So after this slide, I will be inviting them to say hello if they like as well. So, oops, here we are. So our technical assistance providers for applicants are free. And they're available to help eliminate barriers that might prevent you from seeking funding. We realize not everyone has a professional grant writer on staff, and that should not be a barrier. And sometimes it's helpful just to talk out sort of what you're thinking, or if you have more specific questions, and the TA providers may be able to help guide you. So some of the things they can do here: assist in determining appropriate fit, provide guidance on how to best answer the questions and where you can find supportive data if you need that, and to support application review, including reviewing the editing, budget review, but they're not going to write it for you. Okay, and I put a link in the chat where you can find out about who they are and what they offer. And we ask that you reach out early. And if you reach out to one provider by email, do give them 24 hours. And if you don't hear back, you can reach out to somebody else then, but that just eliminates some duplication and confusion. And would any TA providers who might be here like to say hello?
Hi. I'm Hillary Rose. I am one of the TA providers. I'm with Optimum Nonprofit Consulting. If you have any questions, you can feel free to reach out to us. We'll help you through every step of the process, and we're very flexible. Feel free, again, to reach out, take advantage of it. It's free and can really help.
Thank you.
Hi, I'm Hassan Wadari. I'm part of the technical assistance team as well. Thank you so much, Hillary. Teamwork makes the dream work, right? But yeah, as Hillary said, obviously we are technical assistants here to help organizations. And as Juliet mentioned, awesome pieces in this RFP, like, strengths-based and all these pieces. We just are here to guide you. It's not a one-way street. We go with also your process because you know the community very well. So our job is just to help you set that foundation and just explore ways that you can explain your proposal the best way possible. Not to say that you can't do it, you definitely can. It's just, us being there to help you, if you need that help. So please feel free to reach out to any technical assistant, an awesome team.
Thank you. Are there any others here? Those were the two I had in mind. Okay. Well, we will be presenting this information again on April 5th at the Bellevue Library, room 3, and we'll also have a Zoom link open. So it will be a hybrid event, the same presentation. As this is an open funding opportunity, any questions can go through DCHS contracts at kingcounty.gov. And if you are signed into the Zoom grants page, there's a place to ask questions there. Again, you can contact technical assistance providers directly and read about them and get their contact information on the Best Starts blog. And there is a glossary that goes through some of the terms, many of the ones you've heard about today, that can help ground some of what we're talking about. And that concludes our presentation. So I will stop talking for a little bit and see what questions are forming, and I will drop the slides into the chat once more while we do that.
Yeah, thank you so much, Juliet. I forgot to mention one thing. You did mention it earlier, it's the Zoom grants itself. I would like just to give everyone advice that you should start putting your stuff in Zoom grants early, because some of us TAs have had, a situation where some CBOs could not submit a grant because of some technical issues and stuff like that. So please start early. And if you have issues on the day that you're submitting, please make sure you contact the individual on the RFP before the deadline as well. But try to utilize Zoom grants itself. They do have a great technical team themselves. So please, also, we need to put a good focus on that as well. Thank you.
Hello, can I ask a question?
Yes, thank you.
Thank you. Will there be a geographic consideration for in terms of the, how applicants are weighted in the decision-making process? We are part of rural unincorporated King County here on Vashon, and struggle to compete. So I'm just wondering, I have to weigh these decisions as we think about what we should invest our time in applying for.
Thank you, Jenny. I appreciate that question. While there isn't a score way, it's not reflected in the scoring. Where we collect geographic information is unscored. However, it is a priority to make sure we have geographic coverage. So if there are a lot of applicants in one region of the county, they would be more in competition with each other.
Okay.
Also, there are probably less questions overall on this RFP than you have found in RFPs in the past.
Okay, thank you.
Hi there, I have a question. Can you hear me? Hey, I noticed in the RFP that it stated that the only people who would be able to apply for the parent champion pilot are folks who are either currently or have experience with administering developmental screenings. I just wanted to double check that that is the case.
Yes, thanks, Kristen. The Parent Champion pilot is really specific to supporting parents to do the sort of messenger work. We know in a lot of the programs that have been happening over the past few years that some of the sort of best messaging efforts and have been through word of mouth of families, their sort of positive reviews and recommendations. And so we're looking to sort of recognize that, codify, pay them to do this work, as well as, perhaps provide a stepping stone into the workforce. And so because this is really focused in a development-centered messaging, we want the people that are supporting them, so the organizations, to be already well-versed in sort of the background topic and content.
Okay.
And so in this case, it is sort of culturally specific developmental messaging, screening, adaptations for that.
Okay. I have one other question. That's okay.
Sure.
For the second scope of work, under the recommended topics area, the last one listed says embedding shared decision-making in direct service programming that focuses on early childhood development. I was wondering if you could talk a little bit more about what that means or what that looks like.
Yeah, so shared decision-making, I think I have a capital there because it is sort of an emerging research-based strategy of working with families. There's a lot of research on it so far in the medical communities. And so for example, pediatricians using a shared decision-making model. But it's really applicable to anyone working directly with families and children or other people across sectors. And so it's sort of new to call up and for early learning type work. And so I think it's a ripe topic that a lot of people will find helpful to get some support in. I don't know how many people there are out there, with an expert level to bring those learning opportunities around, but this is part of how I'm finding out. So I encourage you all to check out shared decision-making sort of as a concept and strategy.
Thank you.
And so I hope applicants will take a look at these scopes of work and these different buckets and apply for what makes sense for you all. It can be, one full scope of work. It can be one piece of a scope of work. It can be a mixture. Think of it as a menu and apply for funding accordingly. Please do build in planning time, hiring, training, all of that is expected to happen after you're contracted. So and again, there's no minimum or maximum requirement. Okay, I've got a question in the chat. Is there guidelines to how many parent champions are partnered with? No, this is our first sort of foray into parent champions. And so I imagine some programs may choose to start small. Small might be 1, small might mean 3 to 5, and see how that goes and then build. Or I'm not sure if people are even gonna think this is an interesting thing to try out. So there are not a lot of hard answers and guidelines for the Parent Champions pilot because this is a brand new piece of work. This is a good additional element to address. Do they need to have a child or children 0 to 5 currently? Not necessarily. Again, we haven't put, hard lines or parameters, you know, have had a parent or have had a child with, you know, relevant experience is sufficient. And so each program or organization can sort of set their own parameters for what they're looking for in a parent champion and use that. The funding period is 35 months. And so it'd start August 1st and end June 30th, 2026. And I don't know exactly if there will be a renewal option. I hope so. And we'll have to see if it will be a renewal or slightly different opportunity.
Please feel free. All questions are welcome. As Hillary and I know, there's a lot of questions being asked during the TA sessions. So trust me, you're safe here. You can ask questions. You're gonna be good. Julia, I think there's a question in the chat. If we were
Yeah.
funded last time, will that have any impact on the likelihood that we might be funded again?
I will say there is no additional scores awarded for previously funded programs. So sometimes in other processes, there have been additional points awarded or a box that you check to state that you have been previously funded and that earns so many points. That is not present in this opportunity. So I think the likelihood will have more to do about service spread, geographic spread, and the program proposed and how it meets the sort of 4 attributes of culturally rooted, family-centered, relationship-based, and strength-based and inclusive. Well, I really appreciate your interest in this opportunity. I am going to close this out in just a couple of minutes and hope that you will take a deep look and generate some ideas and talk with others and reach out to our amazing TA providers. And can't wait to see all of the great proposals that come in and the kids and families that are touched by this work. So thank you so much for all that you do.
Definitely, and thank you so much for the process as well, Juliet, and the rest of the VSK team. And all the CBOs for the great work that you're doing in the community.